I don't often get the opportunity to be the last speaker. I'm Stephen Bezruchka, but last year I was at a conference and I was the second last speaker. And so I was in a room sort of like this, and I waited. My time came, I stood up and I turned around, and there was only one person sitting there. And I thought to myself, gee, what do I do? Well, I started my talk. I went on for a little while. That person sat there, and I stopped and I said, I'm really pleased that you came to hear me talk right now. But I'm really interested in why did you come? Guess what he said? I'm the last speaker. So I'm really glad you're still here. So I want to tell you about something that sort of fits into what we've heard before, but a little bit differently. That is, I want to ask the question, do you want health or health care? And I want to make this as interactive as possible, since it's hard to sort of pay attention after you've heard a lot of talks. And I want to start by just having a little quiz. So I'm going to ask a bunch of questions, and these are the questions I'm going to ask. The first question is, if you're a 15-year-old girl in the United States, what are your chances of being alive, of not dying before reaching the age of 60, in comparison to a 15-year-old girl in Sri Lanka? How many think the US girl, age 15 today, has a better chance of being alive at age 60 than a girl in Sri Lanka? Raise your hands. Okay. How many think the Sri Lankan girl has a better chance of being alive? Okay. So these are the data. This is from our Institute for Health Metrics and Evaluation, part of the Global Health Department. And what we see here is these are the chances of dying if you're 15 before reaching age 60 over this time period. And back in 1970, yes, the Sri Lankan girl had a higher mortality, chance of dying in those 45 years at age 15. But look what's happened. The curve crossed around 2001, so now the Sri Lankan girl has a better chance, if she's alive at age 15, of being alive at age 60. Just a little fact. So the answer there is false. Next question. Suppose from the period 1987 to 2007, the length of life for women in the United States declined in about almost 30% of US counties. How many think that's true? Length of life for US women declined in about 30% of US. Everybody's raising their hand. There's a herd effect here. How many think it's false? Can't be true. I mean, most people would think that's false, but these are maps of changes in health outcomes. The red being absolute declines in length of life for women, and the same thing for men among counties in the United States over the period 1987 to 2007. Where's all the red? It's amongst the women. 29% of US counties actually had an absolute decline in length of life. Women's health is declining in a substantial fraction of United States counties. Only about 4% of counties for men. So we seem to have reached a plateau in our health improvements. Could that be related to antibiotic resistance? We can speculate on that. So the answer there is true. By the way, that wasn't true for the previous 20 years. That is, length of life kept on increasing for both men and women, but not so after 1987. Third question, maternal mortality, your chance of dying from pregnancy and birthing related causes in the United States has gone up 50% in the last 15 years. How many think that's true? How many think it's false? Okay, so these are the data, just plotting a few countries. Again, our Institute for Health Metrics and Evaluation. Notice in most countries, it's not going up, except in the United States. Our maternal mortality has actually gone up 50% in the last 15 years. That is, more women are dying of childbirth-related causes in this country. So the answer is they are unfortunately true. Next question. According to the Central Intelligence Agency, our CIA, Bosnia and Herzegovina has a longer life expectancy than the United States. How many think that's true? Bosnia and Herzegovina, how many think it's false? It's got to be false. I mean, Bosnia and Herzegovina, all these atrocities and everything that happened there. So if you go to the CIA World Fact Book and you key in life expectancy at birth, you got to scroll down to number 50 before you find the United States. That is, 49 other countries have longer lives than we do, according to our Central Intelligence Agency. They include all the other rich countries and quite a few poor ones. So the answer there is unfortunately true. So a survey of U.S. medical students in 2002 asked them, is the United States the country with the longest life expectancy and the country with the lowest infant mortality rate? How many think that a third of U.S. medical students thought that we were the healthiest country in the world? Okay, that's true. So you already know more than your doctors. And it's true. You go to the medical school here, they don't teach this stuff. It's just not on the radar screen. That is, a third of U.S. medical students in a population sample thought we were the healthiest country in the world. So the answer there is unfortunately true. So this is just a short little quiz. Can we bring it up to date? How are we doing in the United States on preterm births? Did anybody see the New York Times for today, the headline, the lead headline on the left? Just in case you didn't, U.S. fares badly in early births in global study. And in the Reuters comment from one of the lead researchers, the United States rate of 12 per 1,000 live births, meaning preterm, is more like that of a developing country like Sri Lanka or perhaps Bosnia and Herzegovina. Most people there wouldn't say it's developing. Ranking 130th out of 184 countries, tied with Somalia, Thailand, and Turkey, and only slightly better than Honduras and Timor. Now, have I just made all this stuff up? I wish I had, because it can't be true. Here we are, the world's richest and most powerful country in world history. We spend close to half of the world's healthcare bill, and yet Bosnia and Herzegovina does better. Why? I don't know if anybody, so last week in The Lancet, a study was published on deaths of adolescents, that is, people in the prime of life from age, in this case, 10 to 24-year-olds, and this was in The Economist online a day later. What is the mortality of people aged 10 to 24 in the various rich countries from that report? And what do we see? Of course, consistent with everything I've said, there we are with a substantial lead in mortality of adolescents, 10 to 24 years compared to all these other countries. What are we doing to cause this? Notice also traffic accident crashes, traffic crashes. We have much more mortality from motor vehicle crashes than any of these other countries. We do a lot of homicide, of course, so we're bound to, we have the highest rates there. But this is the situation. What I suggest is that we're playing the game of health without a scorecard. Remember Kaminsky Park, the first electronic scoreboard in 1960. Suppose we're just going to the baseball game and saying, let's not keep score. Let's just go and have a good time and go home and get drunk. We don't keep score when it comes to our health. And that's what I want to explore. And I'm just curious, why is it that we don't keep score? How many of you knew these data? And if so, if you did, what do you do about that? It's kind of it's I think perplexing. And so, I went to graduate school in 1966. It was decades before anybody else. And at that time, when I went to medical school, I actually wrote in my notes in 1971 at a lecture, I said the United States had the lowest maternal mortality ratio of all countries in 1951-53, and that was true. We had the best outcomes for women in childbirth of all countries in 1951-53. Now about 40 countries do better. The same thing is true for most statistics on mortality rates or those kinds of easily comparable things, namely other countries have longer lives, however you want to slice and dice it, than we do.